My name is Dr. Shine Ashokan. I'm a sports medicine, orthopedic, and joint replacement surgeon. I do get asked what is the right kind of knee replacement for an individual patient. It's a very relevant question because one needs to understand what stage of arthritis the patient has got. Now, osteoarthritis can involve one compartment, two compartments, or the entire knee. As surgeons, we do a clinical and radiological evaluation of a patient's arthritis. We decide to do a total knee replacement if all three compartments of the knee are involved. Whether you've got the medial compartment, the patellofemoral compartment, and the lateral compartment. However, if the patient's arthritis is only limited to one compartment, we do a partial knee replacement.